People who are now GPs and consultants, people like me, support the juniors and are seen to support the juniors because the government are playing with these people's lives. They've worked really hard, they've got huge amounts of debt, they are committed to their patients, and they are being threatened with something that isn't good for them, isn't good for the country, isn't good for the taxpayer. We are one profession and we stand together.
Doctors in Wales are supporting junior doctors in England in their fight for a fair contract. It seems inherently wrong to impose a contract that would threaten patient safety. We are one profession and we stand together.
I'm supporting junior doctors in my capacity as a consultant. I work in a hospital, and without junior doctors, patients just will not get looked after. We are one profession and we stand together.
Junior doctors are the future of our profession. They'll be looking after us as well as after the public, and it's extremely important that we ensure they have a contract that delivers safe, quality care and gives a satisfying, rewarding career for them. We are one profession, we stand together.
I'm supporting junior doctors because as a medical student and future doctor, I want to work in an NHS that's safe for patients and that's fair for doctors. And if this contract is imposed, it's going to create an environment where care won't be at its optimum and where doctors won't be protected with safeguards. We are one profession, we stand together.
Junior doctors are fabric of the NHS. As a matter of fact, anybody who goes to hospital, his first appearance or his first meeting is with the junior doctors. This particular contract is, in my view, unsafe for the patients and it's unfair to junior doctors. And it undermines NHS in entirety. We are one profession and we all stand together at this very crucial time.
Hello, my name is Louise Irvine. I'm a GP and member of BMA Council, and I completely support the junior doctor's struggle for a fair and safe contract. We are one profession and we stand together.
I'm supporting the junior doctors because they represent the future of our health service. A lot of them are quite senior and obviously are very worried about where they're going to in the future as the consultants. A lot of them are recent graduates who are very worried about the whole structure of the NHS and what they'll be working in. And of course we have a lot of potentials, new doctors coming in from the schools into medicine, and they obviously now are beginning to be aware of what's going on, and it may be having a detrimental effect on actually recruiting medical students in the first place.
We are one profession, we stand together.
Doctors and medical students in Scotland are strongly behind the action that junior doctors are taking in England. This has implications for all doctors across the UK and especially for all medical students across the UK. We are one profession and we stand together.
David Wrigley, I'm a GP and I'm a member of BMA Council, and I support the junior doctors because we need an NHS that is safe and fair for doctors and for patients. We are one profession, we stand together.
All SCS doctors stand by junior doctors in their endeavour to get a fair contract, because ultimately these junior doctors are the future of the medical profession in this country. We are one profession, we stand together.
This is a testing time for us, and we have to stand together. There's no choice. We have to support the junior doctors because they could be in my place tomorrow. We are one profession and we stand together.
The threat to junior doctors is immensely worrying because it's a threat to the future of our health service. We're seeing doctors choosing to leave the UK, we're seeing a shortage of doctors, and also we're seeing proposals for more and more dangerous working hours. We are one profession and we stand together.
It's a long time since I was a junior doctor, and when I was, we used to work regularly 80 hours, sometimes 120 hours. I don't think they can possibly contemplate going back to the kinds of experiences that we used to have. They can't have that kind of experience for themselves, they can't have it for their patients. It's just wrong.
We are one profession, we stand together.
I think this is an attack on NHS staff and fundamentally on the NHS itself and its patients. What's on the table isn't safe for patients, isn't safe for doctors, and I think all junior doctors want is to negotiate, and at the moment what's on the table isn't a negotiation. There's 23 things up for negotiation and the government have said that they'll negotiate one of them. We are one profession, we stand together.
I'm supporting the juniors because we are one profession. They are the future of that one profession. Without them, there will be no profession. We are one profession and we stand together.
We are one profession and we stand together at this very crucial time.